Hi everybody, and welcome to part 2 in my third video on everything you need to know about headaches. And what we're going to be doing in this video is we're going to actually look at all the ligaments, muscles, tendons, and joints that are innervated by C1, C2, and C3. And your headaches, and these are the structures that are most likely responsible for your headaches. If we can make these structures not send the signals, make sure they're functioning right, so they're not inflamed and irritated and firing off these nerves, then they'll stop sending the signals that are going up into the trigeminal cervical nucleus and causing your headaches. Okay, so let's get going with this. All right, I'd like to start by giving you an overview of things. So this side over here, this is the spine from the front. So we are looking at the collarbone right through here. We are looking at C1, C2, and C3, and this skeleton is looking at us. Over here you have the shoulder blade, and you have C1, C2, and C3 in the back of the neck right in through here. Okay, so each one of these slides is going to be looking at it from this point. So the front and the back, okay? So here we go. We're going to look at the nerves. First off, here are the nerves that I'm talking about as they come out, C1, C2, and C3, and they happen on both sides. Now, all of these slides that you're seeing, they've filled out the right side, but they haven't the left. Understand that all the structures that you see on the right also exist on the left in a symmetrical kind of view, but that they're just showing the right side, okay? And so here's the right side of the neck as they're looking at you. The right side is there as the back is turned to you, okay? So again, C1, C2, and C3 are the ones that are some of the bigger culprits in this. All right, now we're going to look at ligaments. The ligaments play a huge role in the spine. What they do is they hold the bones together. So these are the discs right in through here, and these have big, thick ligaments that support these C1, C2, and C3. These bones would just fall apart without these ligaments holding them together. They stabilize the spine. The problems that exist in these, of course, is that first off, there are rich beds of nerves in each one of these joints that you're seeing in these discs and in these joints. Rich beds of nerves that come from the nerves as they come out of the spine at the same level as these structures are. It wouldn't make sense for a nerve down here in your back as it comes out for it to innervate something up here, right? So that's not how the body's put together. The body's put together that as that nerve comes out, it innervates the structures around it. So we know that these are the joints that are innervated by C1, C2, and C3. And if these structures are damaged, like let's say you got in a car accident and ripped and tore these ligaments, then then the scar tissue would come in and it would bind down on these joints, and it would prevent your head from turning to the side, right? It would prevent turning and lateral flexion or bending, lateral bending to the side, flexion and extension back. All of these motions would be irritated at these joint levels if these were restricted and bound down at these ligamentous structures. Chiropractic care and myofascial therapy, especially together, they work really well together, can free up the scar tissue and allow this spine to move better when it is damaged. That's the nice thing about this. If we can affect these ligaments and make these joints move smoothly, so as you turn your head left and right, you have equal motion on both sides, then you're not going to have the irritation in these joints. And these joints are then going to, the nerves that are in these joints are not going to send the signals up into the brain and up into the trigeminal cervical nucleus and cause your headache. This is one of the things you have to do to cure yourself of headaches. Now let's look at some of the muscles that are responsible. Again, the nerves come out and innervate the muscles at the same level as these are. These are called the suboccipital muscles back in here, and these play a huge role in headaches. I am certain that if you have headaches right now, you can actually poke at these muscles in the back of your head, and if you poke like firmly into one, your headache, you will feel your head pain worsen slightly by pushing into these structures. When these structures have been ripped and torn in car accidents, or if they're just splinting the injured joint and they're splinting for long periods of time, these structures become painful, and then these things can then send the signals up into your brain as well. Okay, so these are the big players in the muscles that must be worked on. The best way that I know to affect these muscles is to do two things. You have to use myofascial therapy to free up any scar tissue or restriction in these joints, in these muscles. Make sure that they are back to their normal lengths so that they're allowing your spine to move to the sides. as well as the joints being able to move. You need to make these get out of the way as well. Okay. Again, these are all innervated by C1, C1 and C2 mainly, but C3 as well. Some of these little muscles can also play a role in these. These anterior muscles, these coli muscles are a big problem as well, and they're innervated by C1, C2, and C3. Down here, it's about C3, C2 would innervate this structure here. As they come down lower, they're innervated by lower muscles, but they still all work together and can be a part of the problem. We want to free these muscles up, make them work better. We want the joints to free those up, make those move better, and you're going to. That's the way to decrease the noxious pain stimuli that comes from these structures up into your head. You've got to make them work better, and manual medicine's the answer for this. Now, there is something else I wanted to say in this video as well about these muscles is that we know that people who are chronic headache sufferers, in the research, in the literature, we know that they have weak necks in comparison when they flex forward, when they bend their head forward and back against pressure. If they're resisted pressure, flexion, extension, they're weaker in their necks than people who don't suffer from headaches. So we must also find out if there's a weakness in these muscles and make them work better as well. And so exercise has to play a role, rehabilitative exercise, specifically for your neck. That's the answer for getting over these headaches. Those three things. These muscles over here, remember there's one on this side as well, but you see how this muscle actually comes from way down over in here and goes all the way up into the neck. These, when they're ripped and torn or restricted in their motion, can mess up your ability of the upper cervical area. So things outside of the spine, like this muscle, and then if I go out to the outer layers of the muscles, or this one here, if these things are over restricted, if they've been ripped and torn in car accidents, if they're just shortened because they haven't been used enough and they've become restricted or inflamed, then they too can mess up the function of this area, thus causing those ones to send the signals up into the brain. You must take care of the whole human being as well as just the area of the neck, but it's the neck structure. If we can get all that functioning properly, your headaches will go away, okay? Because now you don't have the noxious stimuli going up in the trigeminal cervical nucleus. Okay, I hope you liked what you're seeing in these videos. I hope this makes sense. In our next video, we're going to be talking about headache triggers. These are the things, you've heard about triggers in the sense of that if I eat a certain food, they'll trigger my headaches. You're going to see how they fit into this understanding of what it's like. If you like what you're seeing, by the way, I want you to understand that I have a special at my office. It's a $50 new patient special. It includes everything in your first visit, including the examination, your first gentle adjustments, any exercises or therapies that I give on that day. There's no extra cost besides that. If you like what you're seeing here, if it's making sense that you've got to do manual therapies to be able to accomplish it, and it's not just one of them, it's not just chiropractic. You have to have the exercise, you have to have the myofascial work, and you work on all of these structures at once in order to get the best results. Okay, the research shows this. If you like this, please call me at 533-1201. And if you mention this video, you get this new patient special. Okay, I'll see you in my headache triggers video next.